Mesothelioma is frequently misdiagnosed as other conditions. Sometimes it takes months or even years before the correct diagnosis is made. This delay can mean missing the window for potentially curative surgery or starting treatment when the disease is more advanced. Today, I want to explain why mesothelioma is so often misdiagnosed, what conditions it's commonly confused with, what red flags should prompt doctors to consider mesothelioma, and most importantly, how you can ensure you get an accurate diagnosis as quickly as possible. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician and this is not medical advice. But understanding why misdiagnosis happens helps you advocate for accurate testing if you're at risk. So let's start with why mesothelioma is so prone to misdiagnosis. First, it's extremely rare. With only about 3,000 cases per year in the United States, most doctors will never see a case in their entire career. As they say, when you hear hoofbeats, you think horses, not zebras. So doctors are the same. They naturally are going to consider more common diseases. A primary care doctor seeing a patient with chest pain and shortness of breath is far more likely to think pneumonia, COPD exacerbation, or heart failure than mesothelioma, simply because those conditions are thousands of times more common. Second, mesothelioma symptoms are nonspecific. Shortness of breath, chest pain, cough, fatigue. These symptoms occur in dozens of common conditions. There is nothing uniquely characteristic about mesothelioma symptoms that screams, this is mesothelioma. Early symptoms in particular are vague and easily attributed to other causes. Third, many patients and doctors do not make the asbestos connection. If you were exposed to asbestos 30 or 40 years ago, working in a shipyard or as an electrician, you might not think to mention this occupational history to your doctor decades later when you develop breathing problems. And if you don't mention it, your doctor won't know to consider asbestos-related disease. Fourth, imaging findings can be ambiguous. Pleural thickening on chest X-ray could be mesothelioma, old inflammation, asbestos-related pleural plaques, or scarring from a previous infection. Even CT scans don't always clearly distinguish mesothelioma from other conditions without a biopsy. Now, before I go on, I'm going to take a break here and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to the reasons for misdiagnosis, there's also the issue that the pathology for mesothelioma can be challenging. Its cells, when viewed under a microscope, can look similar to other cancers, particularly lung adenocarcinoma. Distinguishing between them requires expertise and special immunohistochemistry stains. Community pathologists who rarely see mesothelioma might misclassify it as lung cancer, or they might fail to recognize a malignancy at all. What conditions is mesothelioma commonly misdiagnosed as? For pleural mesothelioma, common misdiagnoses include pneumonia, because inflammation and pleural effusion can look like infection, especially if imaging is done early. It can be misdiagnosed as a benign pleural effusion, which is fluid around the lung. It's attributed to heart failure, kidney disease, or an inflammation rather than cancer. It can be as lung cancer, particularly adenocarcinoma, which can look similar on imaging and even under the microscope without proper testing. It can be viewed as COPD or emphysema, which is characterized by chronic breathlessness and is often attributed to smoking-related lung disease. or as asbestosis, which is lung scarring from asbestos. This can be a misdiagnosis, or it can be correct, but the symptoms are strictly attributed to the benign chronic disease without recognizing that you also have mesothelioma. For peritoneal mesothelioma, common misdiagnoses include ovarian cancer in women because peritoneal spread can look identical to ovarian cancer on imaging. It could be misdiagnosed as irritable bowel syndrome or another digestive disorder with abdominal symptoms attributed to benign GI problems. It could be misdiagnosed as liver disease or cirrhosis with ascites attributed to liver failure. And it could be other peritoneal cancers, gastric cancer, appendix cancer, or cancer from other sources. What are the red flags that should prompt consideration of mesothelioma? First and foremost is a history of asbestos exposure. Any occupational or environmental exposure, even and especially if it was decades ago. This is the single strongest risk factor. Others include pleural effusion, which is recurrent unexplained fluid around the lung that recurs without drainage and without a clear explanation. Pleural thickening on imaging, particularly if it's nodular or irregular rather than smooth. Progressive breathlessness without a clear cause in someone with an asbestos exposure history. Ascites, which is abdominal fluid in someone without liver disease or heart failure to explain it. And when imaging shows peritoneal thickening or masses. If these red flags are present, what should happen? Detailed imaging should be ordered with a CT scan. A chest X-ray alone is insufficient. A PET scan can help identify areas of active disease to target for biopsy, and a biopsy is essential. Diagnosis can't be made on imaging alone. Thoracoscopy or laparoscopy can provide direct visualization, and a needle biopsy will help. Pathology with immunohistochemistry, which means that special stains will be used to distinguish mesothelioma from other cancers. Expert pathology reviewed by a pathologist who specializes in mesothelioma. Those are all the things you need. How can you prevent misdiagnosis if you're at risk? First, know your asbestos exposure history and think carefully about jobs you've held, military service, living in old buildings, secondhand exposure from family members, or living near asbestos mines or industries. Document this history in detail. Second, always tell your doctors about asbestos exposure when discussing respiratory or abdominal symptoms. Don't assume they'll ask. Volunteer the information. Make it prominent in your medical history. Third, if you have unexplained pleural effusion, pleural thickening, ascites, or progressive breathlessness, and you have an asbestos exposure history, explicitly ask whether mesothelioma has been considered. Sometimes patients need to be their own advocates and raise a possibility that their doctor hasn't thought of. Fourth, insist on an adequate workup. If your doctor attributes symptoms to a common condition without doing imaging or biopsy and symptoms don't improve with treatment, push for further investigation. Recurrent pleural effusion should not be dismissed as just fluid without determining why it's recurring. Fifth, if biopsy results show any cancer involving the pleura or peritoneum, insist that pathology slides be reviewed by a pathologist with expertise in mesothelioma. Misclassification of cell type, or even whether it's mesothelioma at all versus another cancer, is very common at community hospitals. Sixth, if you're diagnosed with late-stage lung cancer, but you have asbestos exposure and the cancer appears to be on the pleura rather than in the lung itself, get yourself a second opinion from a mesothelioma specialist. Some patients are treated for lung cancer when they actually have pleural mesothelioma, and the treatments can differ significantly. Seventh, if you're told you have benign asbestos-related pleural disease, but your symptoms are progressive or severe, consider getting evaluated at a mesothelioma center. Sometimes malignancy is missed on initial biopsies and only found after repeat sampling. Now, what if you were misdiagnosed and months were lost before a correct diagnosis? First, don't dwell on that delay. Focus on getting optimal treatment now. Get evaluated at a mesothelioma specialty center to determine current staging and treatment options. Even with some delay, aggressive treatment might still be possible depending on your current disease extent. The window for surgery might have been missed, but chemotherapy and immunotherapy remain options. Consider whether the misdiagnosis affected your legal rights. Statutes of limitations for asbestos lawsuits are measured from diagnosis, so a delayed diagnosis might extend the time you have to file claims against asbestos companies. How commonly is mesothelioma misdiagnosed? Studies suggest that 20 to 30% or more of mesothelioma patients experience diagnostic delay due to initial misdiagnosis. The average delay is several months, but delays of a year or more occur too. This high misdiagnosis rate reflects the challenges we've discussed: rarity, non-specific symptoms, and diagnostic complexity. But awareness of these challenges helps patients and doctors alike prevent or shorten delays. To review, mesothelioma is frequently misdiagnosed as pneumonia, benign pleural effusion, lung cancer, COPD, ovarian cancer, or digestive disorders because its rare symptoms are nonspecific and pathology is challenging. Prevent misdiagnosis by documenting and reporting asbestos exposure history, insisting on an adequate workup for unexplained pleural effusion or ascites, requesting a biopsy with immunohistochemistry for suspicious findings, and getting an expert pathology review. If you've been misdiagnosed, focus on getting optimal treatment now and consider getting an evaluation at a mesothelioma specialty center. You can visit mesothelioma.net for more information about accurate mesothelioma diagnosis, or call us at 1-800-692-8608 or use the live chat feature on our website to speak directly to one of our patient advocates. As for me, remember to post your questions below, and I'll see you next time.